enable that. Mark, are you still there?
We can hear you.
Hi, Susan.
Got it.
Kimberly, do you show that little button now or no?
I'm trying. Oh, I'm still disabled.
All right, let me. Hi, everyone who is on the call. I see 10 participants. And we are just waiting for our district manager to allow Kimberly Flynn to share her screen with us. Let me send him a chat message too. I'm gonna text, let me just. Mute myself. Kimberly, are you able to see a share screen button now?
Let me try. There we go.
Thank you very much, Mark.
Okay.
Excellent.
Bye-bye. Great. Okay, I'm not going to share quite yet, but.
And we're going to wait. Rita's joined. And it's 6:34. So I'm going to start the meeting. Hi, everybody. This is the January meeting of Manhattan Community Board 2, our Human Services Committee. Tonight is really an information session. It's a Zoom only meeting. We don't need a quorum for this meeting, but we have a guest with us who is going to give us a presentation on the World Trade Center Health. You're going to tell me the right word for it, and we'll listen to that. I'm going to just introduce myself and a couple of members of my committee and the board who are on the call. I'm Susanna Aaron. I'm the chair of this committee. Ryder, will you introduce yourself?
Sure, I'm Ryder Kessler. I'm a member of the committee.
And Ritu, you're muted.
Hi, I'm Ritu Chatri and I'm vice chair of the committee.
And Zach.
Hi, Zachary Kazaz and also a member of the committee.
Great, thank you. And we also have Katie Bordenaro, who brought this to our attention and who is not on this committee, but she is on the CB2 board. And I see also some guests. I see Barbara Rich or Reich. I'm not sure if I'm pronouncing that correctly. And Darlene Lutz. And we're just going to go right into it. I'm going to toss this to Kimberly, who will tell us why we're here and will share her presentation with us.
Okay, first of all, I really want to thank you, Susanna, Katie, and all of the members of the committee for this opportunity to share this really important and timely information with you all. So the whole issue of, whether or not people who were exposed to 9/11, who were exposed to the World Trade Center disaster in the community, as opposed to responders, has been fraught. It has required struggle absolutely every step of the way.
Before you go on, I wonder if you can just start by telling us your name and your organization.
Oh, I'm sorry.
No, okay. Please, that's all right.
I'm Kimberly Flynn, and I'm wearing two hats tonight. First of all, I'm the director of an organization called 9/11 Environmental Action. that came together very early in the spring of 2002 as a coalition of residents, school parents, and actually environmental health and safety experts. And we came together originally to demand that the Environmental Protection Agency tell us all the truth, and also to press them to create a scientifically sound test and clean program. We were moderately successful, maybe, on some of that. It was very, very hard. We were battling with the federal government, and that turned out to be quite a lengthy fight. So what I'm about to share with you all, by way of the health program and its eligibility boundaries, et cetera, is not as we would have it. But it is far better than what would have occurred without this sort of continued vigilance and push. That's number one. Number two, really from the beginning, the issue of what was happening to children, and indeed what was happening to, pregnant women, and the developing fetus, that were exposed to this, more than 200 carcinogens, et cetera, on and after 9/11 was a burning question, pardon my pun, because fires went on for, well after Christmas that year. It was constantly a battle. People wanted a screening program for children. We did not get it. The World Trade Center Health Registry was created, and got out basically onto the street too late, and only managed to sign up something in the neighborhood of 300 children. So
Oh, wait, before you go on,
Yeah.
a couple of things. I want to, first of all, there's some introductions I need to make, which is Susan Kent, our chair, is here, and I'm sorry I forgot about that. I also see Stacy Johnson from Senator Kavanaugh's office. Thank you, Stacy, for being with us. And some other visitors. I see someone named Joe Paulette. Can you also just preface your presentation with an explanation of the health registry? Because I think that might be new information to people as well.
So I'm going to give you a little bit of, because there's so many acronyms here and so many entities that are created, all of which confuse everyone. So if you're confused just now, it's a common condition. Basically,
the general idea of all of this is that after 9/11, there was a sense that the people who had been harmed by it were obviously not just the victims of the event itself, the first responders, but that also there was a fallout, an environmental fallout that went far beyond the geography of the buildings themselves.
Absolutely. And the health registry ran into all kinds of obstacles and problems, some on the federal level, et cetera. The health registry signed up 71,000 adults. So that's not bad. I mean, but that's everyone. That's responders, survivors, people who actually were, visiting on 9/11, who might have heard about the health registry and signed up for it. The real problem is that when the health registry, which was, run by the New York City Department of Health, went to the New York City Board of Ed and said, we'd like to recruit for the registry in schools, the Board of Ed refused, absolutely. So at the end of the day, all we have is some 3,000, it's actually diminished since then, 3,000 people who were children at the time, okay, the time being fall of 2001, spring of 2002, and they're all residents below Chambers Street. And I think the schools also all are below Chambers Street. So Chambers Street, as everyone knows, is a boundary line that was drawn that cut out large swaths of the exposed communities. So
And
health
the idea of all of this is that there is an interest in people knowing about this and being part of this registry because there is a federal initiative to respond to people's health issues should they arise.
That's the idea, but we're gonna have to separate. Okay, so the health registry is what existed before and continues to exist. It is what we argued collectively, the Survivors Steering Committee, which advises the World Trade Center Health Program on, the 9/11 related health needs of survivors and how best to meet them. We have been fighting. Community boards such as yours have been in and out of this fight as needed. What we have now is very different. It is going to be called, it is called now already, the World Trade Center Health Program Youth Research Cohort. It needs to be many times larger than the World Trade Center Health Registry, and it needs to be in many ways more representative of the entire population of people who were exposed to the World Trade Center disaster and this is a new language that we're using now with this authorization, when they're 21 years or younger. And I will say more about that later. So are we good with, I'm gonna move to the PowerPoint and explain to everybody what the World Trade Center Health Program is and how it works. And then I'm gonna shift into the Youth Research Cohort.
Yes, that's great. Thank you very much.
Okay, so let me get the start from current slide. Okay, here we go. Okay, that's current slide, and yikes.
And I should also point out that our district manager, Mark Diller, is here.
Great.
And
So
it enables us to have this meeting by Zoom.
thank you. And I'm gonna hope that this is gonna work. The share screen, share. All right, everybody's seeing slide 1.
Yes.
Okay, so as I've said, I'm the director of 9/11 EA. We are now 9/11 Environmental Action. We are now outreach and education partners of the World Trade Center Health Program, but I also have a different role, and that is as chair of the World Trade Center Health Program Survivor Steering Committee, which I described a minute ago. All right, so next. Many of you will recognize this individual, Anne Arlen. She's a former chair of CB2 Environment Committee. She's a founding member of 9/11 Environmental Action, and she's was a resident, late great Anne Arlen was a resident of Soho. And she is one of the reasons why the area of Community Board 2 up to Houston Street, originally up to 14th Street, was included in the federal legislation, and got on this early. She was unrelenting. And I also want to honor the contribution of Ellen Peterson-Lewis, who is no longer with us, as well as Anne, and also Jason Mansfield. I don't know if folks recognize his name, but he was the chair of the CB2 Environment Committee when we were going to Washington to argue for passage of Zadroga. All right, next. Okay, what is the World Trade Center Health Program? It's a limited federal health program that provides no-cost medical monitoring and treatment for eligible responders and survivors with certain health conditions that have been certified as related to their exposures. So that means that these are conditions that, we have scientific and medical evidence going back many years that these conditions resulted from exposures to the toxins in the dust and smoke. The World Trade Center Health Program is not an insurance. It's often confused as such. So when you are a member of the World Trade Center Health Program, as a survivor, you will have doctor's visits, hospital stays, prescription drugs, and surgeries at no out-of-pocket cost. Okay, next. And who are survivors? I'm sorry, I've been throwing this word around for the last 10 minutes. So survivors are not responders. They're the community, residents, students, area workers, people in daycare or adult daycare in the New York City disaster area, which I'm going to show you soon, who were directly impacted and adversely affected by the events of 9/11 and its environmental consequences. Survivor eligibility. So the way that survivors are eligible for the health program is informed by answers to two questions. First question is, were you there? And there is the New York City disaster area, and the map is coming. And the second is, do you have symptoms or conditions that you believe are linked to your 9/11 related exposures? Here's the map, the New York City disaster area. So basically, it goes up to Houston Street, and there's this wedge into Brooklyn. So the idea was that it was the land that was 1.5 miles from the site of the World Trade Center. There's a problem with that. I will return to this later on. Houston Street was not the original boundary line. Houston Street is what you get, you know, when you have to go into the Congress and ask them to cover care for affected people in the community. So, were you there in the New York City disaster area during, well, it's after 9/11, it's on 9/11, after 9/11, but how far after 9/11? Well, it's through the cleanup, and the cleanup ended on July 31, 2002. And what are the reasons that you may have been there? Did you live there, work there, go to school there, child or adult daycare? Or 9/11 itself considered to be a major health exposure. Okay, next. And these are the symptoms. Do you have any of these symptoms that started up after 9/11 or became worse? So there's also a way that you can qualify for care if, for instance, you had pre-existing asthma, but after 9/11, it got worse. So these are, you know, this is a grouping of symptoms for the most part. The physical symptoms at any rate, cough, wheeze, shortness of breath. It's a lot of respiratory, sinus congestion, etc. And then they added stomach problems, gastric reflux. So when you put these all together, doctors and scientists began to call them aerodigestive problems because it's sort of one airway, and people typically were affected in multiple ways. So that's one piece. These are sort of the bedrock conditions, the first conditions that were automatically added when the Zadroga law was passed in 2010. In addition, of course, are mental health conditions, post-traumatic stress disorder, anxiety disorder, depression, and some of those people who had milder mental health problems earlier on are now struggling with some more chronic mental health problems now. So that's sort of the first group. Then what happened beginning in 2012 was that a very long list, 50 or so cancers were added, and it took a while to complete the cancers that qualified for coverage under the World Trade Center Health Program. The last one was added basically 2 years ago, and that was uterine cancer. So right now, you pretty much any cancer, any malignancies. So some brain cancers are not malignancies, and those unfortunately are not covered. But it's a huge thing. And again, struggle involved there. I won't go through the whole history. But yeah, took a fight.
Can you use the acronym Zadroga? Can you just tell us what that is?
Zadroga is the James Zadroga 9/11 Health and Compensation Act. So James Zadroga was a responder who died as a result of his 9/11 related exposures, but he was a New York City cop, but the city denied that he died for that reason. And in fact, some of us who went to DC heard certain members of Congress who were hostile to the entire project claiming that James Zadroga died from like injecting opioids. It was disgraceful. It was disgusting. His family was present. So Mrs. Maloney actually was the person who came up with the idea, okay, what we need to do is we need to stand with James Zadroga, this victim who was told, whose family was told that he was not a victim at all.
Thank you. That's very helpful.
Yes. Thank you for asking. So, because there are a lot of these names and committees, et cetera.
Yeah, well, the acronyms, I can't tell you what happens to the acronyms in the transcript that we get. So it's helpful to
Oh
spell.
my God. Okay. Oh boy. Okay. So we're back to the equation. If you were there in the New York City disaster area and you are experiencing at least one of the symptoms or illnesses that the list I just gave you all, then you should apply to the World Trade Center Health Program. You may be eligible for care. You likely are eligible for care. We can't say that you're eligible for care because only the federal government gets to say that. So there's a full list of conditions at this link. It's pretty exhaustive, but there are conditions that are not covered, and I'll address that in a minute. Okay, so if you're a member of the World Trade Center Health Program and you've been accepted, you're a survivor, you're a person who was exposed in the community and developed one or more of these symptoms, where do you get this care? In New York City, where you go is 2 clinical centers of excellence. One is the flagship, the World Trade Center Environmental Health Center, otherwise known as the New York City Health and Hospital Survivor Program. This program has clinics at Bellevue Hospital Center, Gouverneur Health Services, and Elmhurst Hospital Center. And then there is another center at the William Street Clinic, which is operated not by the City of New York, but by Logistics Health Incorporated. And they are actually beginning to expand some of their treatment services. But right now, the full operation is at Bellevue, Gouverneur, and Elmhurst. So you may ask, what happens to people who are no longer living in New York City? Well, there is a nationwide provider network, which is an extensive network of providers across the country, and that currently is being administered by MCA Sedgwick. Okay, so before I completely launch into the Youth Research Cohort, does anybody have any questions right now about the program?
I just want, before I will open up to any questions, just to sort of sum why we're hearing all about this. This is information for anyone who is hearing this, who feels that they might qualify for this, to encourage them to reach out and get registered.
Absolutely. And here is the other reason why we're hearing about all of this. Thanks to, again, an enormous struggle, and I would include as agents of struggle, the New York delegation. I would certainly include Senator Gillibrand and Congressman Nadler and Congresswoman Maloney and Congressman Pete King. And now there are other members of Congress who have joined this team from New York City and Long Island. Basically, we now have a World Trade Center health program through 2090. So that's incredibly important. And I can talk later about the Victim Compensation Fund. It's just that I want to really get through the Youth Research Cohort and make sure that everybody understands what that is before I add yet another acronym, Susanna. So, what needs to happen right now is that we need to ensure that the World Trade Center Health Program is prepared to cover conditions that are emerging in adults for which there is beginning to be evidence, but also, and very importantly, conditions that emerge specifically in people who were exposed at an especially vulnerable age when they were developing. And to use the language in the authorizing legislation, people who were 21, who were exposed to the World Trade Center disaster when they were 21 or younger. What has happened, and it's complicated, and it wasn't, it wasn't by design of the World Trade Center Health Program. What has happened is that there really is only one research cohort that meets scientific standards. And that cohort is largely made up of adult men. The fire department has an incredible cohort that is basically like the gold standard for research. And there is a very large responder cohort, some 85,000 at this point. This cohort is made up of people who were exposed to the disaster, some of whom are sick and some of whom are not sick. So that is the sort of that's the research standard that any cohort has to meet. We do not have on the survivor side a cohort that meets that standard because the World Trade Center Health Program is only available to survivors who are already sick. You have to be sick. That's part of your ticket in to the program.
And
So
I think when you say a cohort that meets scientific standards, I'm going to guess it's a question of sample size primarily.
I'm talking about sample size is very important, but what is really, really, really important is that the cohort has to be based on, hey, these are the people who were exposed. It cannot be kind of predetermined, oh, here everyone in this group is sick. That's disqualifying. Now, there is some research being done on survivors, and Dr. Joan Reibman, who was the medical director of the World Trade Center Environmental Health Center at Bellevue, Gouverneur, Elmhurst, she's done some really spectacular research, but she is very clear that her research cannot tell us what is emerging and in the exposed population, cannot tell us. The scientific terms are incidence and prevalence. Can't do it, because in order to do that, you have to track people based solely on that they were exposed. What the Youth Research Cohort is going to do is exactly that. So it's critical in terms of providing the knowledge, certainly that people who are now young adults need. They desperately need this knowledge. We know some of them who feel blindsided, and we would feel blindsided too, obviously. I mean, I can talk about Kendall Chapman, who was 5 years old on 9/11 and living on West Broadway and Reed, who came into a Community Board 1 meeting about a year and a half ago and spoke to CB1 about what it was like to be away at school and, you know, at the age of 20, be told that you have thyroid cancer. Thyroid cancer is one of the first cancers that research showed was emerging in the fire department.
So
And
it's important that both healthy, that lots of healthy people.
absolutely
part of
critical.
this.
If we
Okay.
don't have, if we don't capture, I'm not saying we have to capture everybody. I mean, because let's talk about how many people under the age of 21 were, for instance, living, going to school, daycare, etc. Some may have had jobs, right? Who were adolescents below Canal Street and into Brooklyn, in the New York City disaster area. How many children do we think were exposed? And again, children, census data that we looked at were 19 years and under. 40,000 approximately. That's a lot. And
Right. So in an ideal world, you end up with a cohort of 40,000 people. Or
well,
something like that.
well, I don't
I
know.
don't want to
that there's
reduce
a-
what you're saying.
I don't
but-
think there's a universe in
Right.
which we will, but what the federal government is talking about sort of from the beginning is at least 7,000.
Okay, great. I think you can go to the next slide.
Okay, yeah, because I've done this, all right. Oh, and there's one extra thing here though, control population. So the entirety of Brooklyn, you'll see, is on the Youth Research Cohort map. Okay, so here's the purpose, again, really important. And it's going to be very important in recruiting everyone to work on this project and recruiting young adults who really don't want to, nobody wants to be sick as a result of 9/11, and young adults especially. This cohort is going to be used to study the mental and physical health impacts as well as educational impacts from 9/11 exposure, again, among those who are 21 or younger. Prior child cohorts too small to detect physical health impacts that may be emerging. So cancers, forget it. But there are many other issues here as well. Autoimmune diseases. We have some anecdotal information around autoimmune diseases emerging in a population of young adults. Also, reproductive issues. You know, like PCOS. I don't know if people know what that is, but basically, it has to do with problems with ovaries and cystitis, cysts on ovaries, etc. We have you know, lots of complaints about menstrual irregularities. There are complaints about infertility. And so we have to get a handle on this, and we owe it to them. They never got studied, and now they're adults. And now for some of them, and again, I'm not claiming, this is not Bhopal, okay? It is not the case that everyone's going to be sick. Most of them are not sick, or they have, they have some breathing issues. They have like sinusitis. Okay. But you don't know who will develop, as Kendall Chapman said, to CB1 thyroid cancer. So we've already seen some of these cancers showing up. And the reason it's weird is that they're actually too young. So the sort of population data about the onset of these cancers, they're significantly younger than what if you were looking at, the population of the United States. So you need a really large cohort, much larger than the health registry, in order to have a prayer of detecting what might be emerging. And we owe it to them, and we owe it to ourselves to know. So has to be of sufficient size to conduct future research studies. And it has to be representative. So that means that it has to be racially, it has to be ethnically, it has to be socioeconomically representative. The World Trade Center Health Registry, and they literally had to admit this in some of their publications, using their child cohort. The problem with the cohort is that it is overwhelmingly disproportionately affluent. So, you know, a lot of fortunate kids from Battery Park City, I mean, very unfortunate in that they were exposed to the World Trade Center disaster, but fortunate in other ways, are in the health registry. They made an effort in Chinatown, but it didn't pay off. So this is our chance. This is the other piece, where what we have to do is activate every community, and that's why we went, board 1, board 2, board 3 in Manhattan. I was at board 2 in Brooklyn last week. And this was the point, Susanna, that you had emphasized. It has to include individuals who are screening eligible World Trade Center survivors or certified eligible. Now, what that means is screening eligible means they were exposed, they're not sick, okay? Certified eligible means, and this is all the federal government's language, not mine, certified eligible means they were exposed and they are sick.
Okay, great.
So we have said many, many times to the World Trade Center Health Program that this is going to require a full court press, and that there will need to be community input, detailed, meaningful input at every step of this process. So, and I think they even understand it because, this is an incredibly challenging project. It's the first time that there's going to be an attempt to form a disaster cohort, more than 2 decades after the disaster. So they know it's not going to be easy, and they know that they don't have a roadmap. So this is the first request for input in the form of a formal request for information, an RFI that was, where they issued a Federal Register notice. We kept pushing back the deadline because it took time. It took time to really have the conversations. I mean, you all have the reso that boards 1 and 3 have passed. I worked with Mariama James, whom some of you know, and the Quality of Life Committee at Board 1 to come up with that reso. We had to walk around 360, and I know time is short, but I'm going to ask you all if you can walk around at 360 also, not in the sense that, I think I basically captured a lot of what we would ask the federal government to fund, for instance, very important. But the ask for every district is there something missing? Is there something you need to add? If you think about how in the world you would find, reach, and recruit these young people, what would that look like in your district? Is that captured in the reso? Is there a piece of that that is not captured in the reso?
Essentially, the task is basically a marketing task, right? The task is to get a lot of people to know this and a lot of people to sign up for this. That's the task, right?
I would say that is the broad strokes of the task for sure, but there's going to need to be community. We're going to need the federal government to engage community-based organizations, because if you just do like the most brilliant app in the, hire a company to design this wonderful app and a PSA that will go to people's cell phones, it doesn't mean that they're going to sign up. Doesn't mean that the kids, speaking from somebody who is much older now, the kids are going to say, oh, what's this? I don't know what this is.
So
Um,
when you say engage, what you're saying is that there's got to be an ask to ask federal agents of some sort to take on the task of going around and getting people to sign up.
they're not going to go around. They're going to hire people to go around.
Okay,
And some of the people that they should hire, and we addressed this in the reso, but again, further details, so welcome. Some of the people who are going to go around are going to basically be young influencers who are eligible and who should get paid a salary to do this work. That's going to be really important. And the other thing that's going to be really important is community organizations who still have relationships with families in the area, who are trusted. And some of these are, some of these are places like, I mean, a really good example is the settlement houses on the Lower East Side. They ran after school programs. They still have contacts with a lot of these families. So again, to turn to them and say, okay, now, we're asking you to go back through your paper archive, which is also another challenge, and then get back in touch with these families. Those groups are going to need to be funded to do that work.
so this ask is an ask for money to be able to fund this campaign.
That's part of it. And again, the other thing I want to just throw out there, because I didn't address it in my PowerPoint, is, there are different categories. There are the resident children, right? There are the children who were both residents and students. And then there are the children like the Stuyvesant children who have gotten more of a spotlight because the parents were better organized, and because Lila Nordstrom, a Stuyvesant alum, has now a Facebook group with 500 Stuyvesant alums. They were mostly not exposed, from living in the neighborhood, but they came in to go to class. So that group is going to be a little different. The group that went off, to college is going to potentially be a little different. So, again, there's going to probably need to be some kind of national ad campaign. These are certainly ideas that we've thrown out to the people who are leading this effort for the World Trade Center Health Program, and they seem to agree. But there also is going to have to be a strong local effort.
Great. I'm just mindful of time. I think we should
Yes.
go on with the presentation so that we have a little bit of time for questions.
It's pretty much over. So look, we have until July 29th. And again, this is the
Wait,
beginning.
July 29th or January 29th?
Oh, I'm sorry. Wow. Sorry about that. That was a brain glitch. Oh, January 29th. We'll have another deadline in July, I'm sure. But this is really, really tremendously important. And also for the federal government to see that the community boards who, have all or part of their district in the New York City disaster area are interested, are pledging support, but also are going to be making demands, are also going to be, calling for an ongoing dialogue, meaningful input going forward is very, very important. So you guys are used to this. I mean, this is a public comment type opportunity. So it means that everything's going to be published, right? It's going to be publicly available. And I'm really just so thrilled that you guys are able to, take this on. I know there's not a whole lot of time. Now, this is really important. It's a World Trade Center Health Program Youth Research Cohort map. So you see that, and don't love the legend. It turned out to be very small. So you can see how there's this sort of more reddish zone, the New York City disaster area I've been speaking of. And then you can see how the zone in Manhattan for Youth Research Cohort eligibility goes up to 14th Street. And then you can see this huge chunk of Brooklyn. So the question here is, how much of this area is going to end up looking like a control group, right? Control group is very, very important. But as those of us who, first worked to get Zadroga passed understood, these boundary line at Houston Street, the boundary line into Western Brooklyn, these were politically established, right? So we believe that another opportunity the Youth Research Cohort project is presenting is to revisit, well, did the illness really stop here at Houston? Did the illness in Brooklyn really stop here? I mean, in our outreach work, we've gotten calls from people in the West Village who were sick. We certainly know people from the East Village who are sick. We've gotten calls from Red Hook in Brooklyn. So it's really, really important for us to see, can we bring in a lot of young adults who are in this paler purple area? And I'm going to go, I think I have one last. Oh, actually, no, this is just more, again, this is more on the public comment and RFI. And with respect to the health program, contact information, also available on the website. And this is us, 9/11 Environmental Action. Anybody who's at this meeting or who knows somebody who should be in the World Trade Center health program, we work helping people to enroll. And it's not always easy to enroll, 2 decades later. You do have to produce some documentation. Anyway, give us a call, get in touch with us. We've been doing this for years and we're happy to do it. All right, here we go. So back to the area between Houston and 14th Street. This is excerpts from a study that was done in 2009 by, led by Dr. Joan Reibman with a lot of NYU and Health and Hospitals scientists. Characteristics of a residential and working community with diverse exposure to the World Trade Center dust, gas, and fumes. We describe the population as a whole and group by potential population exposure category, defined as local worker, resident, cleanup worker, or those involved in rescue and recovery. Residents or local workers lived or worked south of 14th Street on September 11, 2001, or within a year after the event. The results, again, the results do not differentiate, people who were exposed between 14th and Houston and people who were exposed below Houston. Everybody presented with that, the aerodigestive thing that I was talking about, that syndrome. Results, upper and lower respiratory symptoms that began after September 11th, persisted at the time of examination, so, years and years later, were common in each exposure population. Exposure population meaning, local workers, residents, cleanup workers. Conclusions, residents and local workers, as well as those with work-associated exposure to WTC dust, have new and persistent respiratory symptoms with lung function abnormalities 5 or more years after the WTC destruction. So this study was done, okay? And they had their eye on our members of the community going to be, who have been receiving care thanks to, actually, don't want to go through that whole history, but thanks again to community push and let's give credit where credit was due. Michael Bloomberg, when he was mayor, basically made a $6 million budget and expanded what was then called the World Trade Center Health Impacts Clinic at Bellevue, expanded it to Gouverneur and Elmhurst and funded it, City of New York rather, funded it in his capacity as mayor. And they, again, the eligibility was, were you south of 14th Street? So what Dr. Reidman was doing was creating, a study that would characterize this community that was being treated at the World Trade Center Environmental Health Center. And her argument, as you can see, is, oh, look, these members of the community are experiencing the same kinds of upper and lower respiratory symptoms as responders.
So this study essentially establishes the link between exposure and illness.
I would, to some degree, it does. There are many, many different kinds of studies and many kinds of, I shouldn't be answering your question the way Dr. Reidman would. So, no,
That's quite all right.
She would say, well, she would give you a very long set of provisos, but basically.
But for the purposes of this presentation.
For the purposes of this
I
presentation.
think what you're saying with this slide is that there has been study of this, and there is a scientific conclusion that this exposure in fact has led to illnesses, and hence if you have an illness and you were in this area, you should get it checked out because it may very well be due to that exposure.
Absolutely. She is saying, based on the people that we've been treating, right? Based on the residents and area workers who have come into this program, this is the clinical evidence. They have the same problems as responders. But for this purpose of saying, hey, can we get young adults in this cohort up to 14th Street, is this possibility of revisiting the boundary line at Houston Street.
I see.
I've also said
So
this.
youth cohort might, in addition to helping the people who are in it, might also broaden the definition of what exposure was by enlarging the area.
Yes, it may. And the other thing that I'm not going to say near as well as Dr. Reidman is, the World Trade Center disaster was a huge environmental exposure. And the research that has come from this horrible, horrible disaster has the potential to inform, the entire medical and scientific community about the risks of exposure. So there is a how does exposure hurt you? Critically important piece that, is something that doctors and scientists need to learn much, much more about. How do environmental exposures actually hurt you? But also, there is this issue of lessons learned. Don't do this again, folks, right? If something like this happens, what you need to do is you need to evacuate people. You need to tell them the truth. You need to get adequate data. Your data cannot all be collected, exactly at the site, et cetera, and so forth.
Right, got it. That's great. Are there any questions from anybody? If you have a question, please just raise your hand. We have time to answer questions. And is this the end of your presentation, or is there more?
I'm pretty sure. Let me see. Yep,
Okay.
that's
Okay.
it.
That's great. Well, I don't see any questions. This has been very informative. Thank you so much for coming in and sharing this with all of us. I will share with the members of my committee the resolutions that we've seen from CB1 and CB3. I'll probably tailor that a little bit to fit CB2 better. And our plan is to discuss this at executive committee and with the expectation that we will present it to our full board next week, 2 weeks from now. No, next week. And if that is all, Kimberly, I'm just going to thank you so much for coming.
Thank you.
Katie has left our meeting, but I want to thank her for bringing this to our attention. And thanks to the members of my committee who were able to join tonight. Thank you.
Thank you so much. And
Very
thank
well.
you for moving forward. Okay.
Great. Thank you so much. Good night, all.
Good night.
Bye-bye.